Hi, this is Ingati. I am doing a story time, so I just wanted to show you guys this first. Okay, I think I got it now. How to do this properly. Anyway, these are all my meds. Those are some other things that I take. Yeah, some pills and my nebulizer and all that stuff, or my pump. Anyway, I just wanted to kind of, give you guys a picture, um, because today I am finally talking about my the medications and the my medical diagnosis. And the only way I can do that is actually by picking picking up each one and try to show you guys. Um, okay, so um, I do have two of these. I have two separate ones. One is for acute asthma attack, and then the other one is for um, just something that I take to kind of maintain my airway. And then I do have this I take for my pain, like a cream to rub when I'm feeling pain. And then this one is for um, certain parts of my body that have rashes, because they're, when you are so big, you have like skin upon skin, and you can get yeast and fungus in those places. And so that's what that cream is for. I had a cream that I used for my ulcer, but as I told you guys, with the cream and with the cream and just my daughter will do some like a pedicure for me, like once a week, and that was a big help. And also the juice fast that I did for 22 days, that went away. Now I had been using the cream, and I had to take antibiotics for a while. So I had been using the cream for the ulcer and the antibiotics, and my daughter was doing my pedicure, and the ulcer did not totally heal. I had been taking those for like, I guess, June, July. Yeah, June, July. Um, I was having those issues, and it didn't heal, and it was very painful to walk on. Anybody who has had a foot ulcer, that stuff hurts. Um, but I did the juice feasting, and within the middle of that, the ulcer was gone. It was totally gone. It was totally gone and clear. So that was that was awesome. That was awesome. Yeah. And full disclosure, I did not, in August when I started the juice feasting, I by that time I wasn't taking any antibiotics, and I wasn't putting the cream either, because I had done that for like 2 weeks, and it hadn't healed. Um, but once I did the juice feasting, that helped. That helped a lot, and that was totally gone. So I think when I just gave my body a chance, where it wasn't using so much energy to digest food, and I went on a juice fast, then it used that energy to heal. And the ulcer was one of them. So let's see here. So I'm gonna just, all right. So I have a severe vitamin D deficiency. So I actually take two different vitamin Ds. One is the D2, one is the D3. Um, And the D2 I take once a week, and the D3 I take daily. And usually people of color usually have low vitamin D. And what that causes, it really messes up a lot of issues in your body, because you need an adequate amount of vitamin D to break down the calcium in the body so that the body can use calcium. And when you don't have enough vitamin D, you're not able to do that. The body's not able to do that. And calcium is just one of those things that your body needs in order to do any chemical reaction in your body. Needs calcium. So if you don't have enough vitamin D, then your body's not able to break down that calcium so your organs can use them, your cells can use them. So I'm very low in vitamin D, so that's why. And sometimes, every time I go to the doctor and I get blood work, I'm still low. So I'm hoping that with this fasting, that I will see some results, on that, where my vitamin D will finally come up. And it takes a while for your vitamin D to get up there. So, like I said, I'm severely lacking. And then I take this medication I take for GERD, gastroesophageal reflux. So it's like just like not gas coming back up, but it's like food kind of comes back up. That's how it feels like to me anyway. Goes up your esophagus and it kind of empties back, like at the back of your throat or the base of your throat, and it always feels awful. And then also I'll have I used to have ulcers, so I'll have like these cramps right beneath my breastbone, and it hurts so bad. And in the past, what I was doing, I have to eat something, and once I eat something, for some reason that pain goes away. But with this, then I don't have to have food in my system. I can, do my fast, and when I get that problem, I actually take these pills. And I do take my pills during the fast because some of them I really do need. Okay, and this one I actually take because I get allergies, so I do take this one for my allergies, seasonal allergies. This was the antibiotic that I was taking. Actually, I have to throw that away. This one I take this. This is one of my pain medicines. It actually is really good because I was having a lot of cramping. It felt like the muscle will just bunch up and it will move like through my calf and my legs and the back of my thighs. It was so painful. Once they added this to my hard pain medicine here, this one is really strong. And then I have this one, I think is kind of like more of like a maintenance. But once I added this specifically for muscle cramping, then I didn't have to do too much of the hard stuff, So that was good. So that's for pain. And I get pain from, I think I said so before, I have arthritis and I have some other issues in pretty much every joint in my body and under my feet. I have like bone spurs. And so yeah, I'm on pain meds. My one of my doctors was actually wanting me to take um, marijuana for the pain, but for myself and my family, we have issues with addiction in terms of it's very easy for us to become addicted to stuff. So maybe somebody, you know, um, maybe they have to drink, I don't know, 6 things of alcohol or, smoke, I don't know how many joints of marijuana. I don't even know if I'm using the right terms because I don't drink and I don't smoke marijuana. But maybe they're doing that, you know, and they're fine. But for us, in my family, we take one and that's it, we're hooked. And so we have just that issue. And because of that, and I even tell my children too, stay away from stuff like that because our family, we have a problem with that. We get addicted very easily. And, maybe it's one of those generational curses. I don't know, but, yeah, I just told my doctor, no, I cannot do that. They said, oh, well, it's not the same. Medicinal marijuana is not the same. No. I will just work with what I have. Everyone has to know their own family dynamic, their own family history. And, there's just certain things I just want to leave alone. But I am definitely not against medicinal use of marijuana. I'm not against that. If that's what works for you, then that's great. This works for me. So it doesn't take away the pain, but it makes it manageable. That I'm able to kind of get up and go somewhere. And I don't take all of the pain meds. I'm allowed to take 3 of this, and it's quite a bit. For the pain meds alone, I'm allowed to take a total of about 12 pills in 24 hours, but I don't. These days, since I've been on the juice fast, I take like four a day. And actually, when I was really doing the juice fast, when I was doing that 22 days of juice fasting, I was down to just 1 pain pill, and that was amazing. Because I was fasting, it worked more efficiently, so I really couldn't take more because it has the side effect of making me drowsy. So I really couldn't take that much when I was juice fasting because you just take one and it works. It works like a charm. That's what I love about the juice fasting, and I am looking forward to doing it again. And then this one I take for, I have congestive heart failure, which, all of these things, well, I'll talk about that later. And then I take this is like my water pill, and the potassium goes with that. And that helps to, get that fluid from my lower extremities. And it also will drop my blood pressure. So when I'm on the juice fast, I have to be very careful. I do have my blood pressure and heart rate stuff, so I can monitor before I take my medication. I can monitor what my blood pressure and heart rates are, and so that way I stay within the parameters. I only take them when I'm out of the parameters. And then this is my heart meds, and I had 2 heart attacks so far. I had one in the summer of 2018 and another one in February 2019. And then let's see here. Was it February 19? Yeah, it was February 2019. Yes. So let's see. And then this one is for also the heart failure. And I have another one for my blood pressure. And then this one, I have this one for anxiety. This one is for incontinence. This one is for insomnia. This one is for, what is this for? Yeah, this is for, I get hallucinations, and this one is for anxiety as well. And I think that's it. That's it. Right now, yeah. So that's it. It's not all of my diagnosis. There are, there's something else, but I don't want to discuss that. I actually don't want to really talk about that. Yeah. I don't want to talk about it now. But I will certainly share one day. So those are the reasons, those are the things that that I'm going through now. My problems started when, in 2008, my problems started in 2008. I will say, yeah, no, that's not even true. That is actually not true. They started maybe when my son was 1 year old. 1 or 2. Yeah. He was still a toddler, and I was having problems just walking. I was having problems walking. And my mom said, hey, you need to go to the urgent care, get this checked out. Because at that time I was like 200 and about 230, 240. I just felt like it had a lot to do with my weight. And anything that I was going through, I always said, oh, it's my weight, oh, it's my weight, that's what's causing all these things. As soon as I lose weight, I will be fine. And so this time my mom told me to go to the doctor. She checked me and wanted me to have a slew of other tests. She wrote a bunch of, things that she wanted me to go follow up with. But, I couldn't. I just couldn't at that time. And when I am doing my story time, I will tell you about that. Because this video is going to be much longer than some of my other videos. But, yeah, so these are the things. So that's when my issues started. I will maybe go see the doctor every couple of years. Or every couple of years, to just make sure things have not gotten worse. And yes, the doctors were very frustrated, but, I did not have the luxury of going to see I just didn't have the luxury of being, too ill, I'll say. Anyway, then 2000 and I started seeing my new doctor, I think in 2013. The old 13, maybe it was 2011. I started seeing this one that remember I was saying that I was so happy to go back to this doctor that I had for like a decade. Yes, so I started seeing her, I think it was 2011. Anyway, 2014, she says to me, you gotta take some time off, like a lot of time off, because some of the symptoms I was having, I was just living with chest pain, Sometimes it'll occur, and, I'll have this chest pain. Sometimes I'll have like this pain deep in my, like pelvis just in there. And it'll be so painful that I'll double over, and I will not be able to walk. So she had a bunch of tests that she wanted me to go take, and that was in 2014. And she said, you got to take, maybe like, 2 weeks to a month. Just go get all these tests done. Let's see what's really going on. I didn't go. And then in 2015, I, 2015, some of these symptoms were getting worse. And I went on medical leave, got some stuff, done, but went back to work, 2016. Yeah, I went back to work. 2015, I went back to work because I was on medical leave for like a couple of months. And then I went back to work December of 2015. And then I knew that I wasn't feeling, where I should be. I knew that I was experiencing those symptoms that she said, if you're having these symptoms, if you're short of breath, if you're in pain, if you're having chest pain, you really need to come to me. But I didn't do that. I think it wasn't until 2017, towards the end of 2017. 2016 was a very busy year for me. My daughter was going off to college. And so it was a really busy time. And no, that is no excuse. I'm just telling you the truth of what happened. And then December of 2017, I went to her and it was getting very harder and harder just to breathe. And the chest pains were like not going away. It was like it was radiating, to my back and down my arm, and it felt like this crushing, piercing pain. And I went to her and she, was telling me to get some tests that I thought, well, why is she telling me to go get this particular test? I talked about my heart. And so that's when it happened. And once that happened, it just became worse. My health just continued to decline until I got to the space where I could barely walk. I could barely do things for myself. I just, my health consistently, continued to decline. And then, and as my health continued to decline, it wasn't just my physical health, but also the mental health. Like I started having these hallucinations and started hearing voices. And I will hear things and run out. And I started seeing a psychiatrist when I was in the toilet one day and I ran out and I was upstairs. I was like yelling down, do you guys, what's going on? Sounds like someone is fighting. And my mom happened to be in the house at that time, and my daughter just came out, and my underwear, I hadn't even pulled it up from the toilet. I just got up from the toilet and ran. And when she looked at me, I still see that look on her face, like just that horror, concern, like, Mom, no one is talking down here and no one is fighting. Go to the bathroom and pull up your underwear. Yeah. And as I kind of went back, my son put his head out of his room like, okay, she is absolutely losing it. After that, yeah, I called someone and started to see someone, and reluctantly started taking meds for that. I don't like taking meds, so the fact that I have so many meds now, that was something that I had to get used to, because since 2014, the doctor will give me a prescription and I wouldn't take it. And I actually didn't start taking these meds until um, 2018, I think, yeah, 2019, yeah, because I stopped working 2018, early 2018. And even when I stopped working, I was like, oh, I'll be back in 6 months. No, yeah, I wasn't back in 6 months. I just got progressively worse. So here I am now. January of 2020, my doctor told me that I was not going to get better. I was going to get progressively worse. Um, and to think about, maybe going to a nursing home. And I did not want to do that. That was a horror because I used to work in a nursing home. And nothing against nursing homes, but I didn't think I could handle that at all. But when she told me that, and one of the things I think I asked her was, one of the things I asked was just, well, maybe it's my weight, and she just lit me up. Like, it is, stop saying that. You actually have issues that have nothing to do with your weight. You have problems. So, um, even if you lose weight, you're still going to have these problems. You know, yes, obese people have problems, skinny people have problems. This is a health problem that you have. And this is your new norm, and you have to get used to your new norm. So that was January 2020, and it really brought me into a deep depression. Um, I was just in a deep depression for like a while. For a while, I was, you know, I just kept on going, kind of in and out. And I think it wasn't until maybe towards the end of 2020 or early 2021, I told my psychiatrist, okay, I think it took me this long, but I've made peace with this is my new norm. So what's my goal, right? My goal probably will never be as much as I want it to be. I will probably never get to totally healthy. And this is what I told my doctor, but my goal now is kind of to maintain, because earlier this year I was in the hospital, and they were actually going to they were going to admit me, and I discharged myself, and just talked to the doctor, and just like, I know some of the things that I have to look for. And if once I got there and I was stabilized, um, I just said, I know what I have to look for. And if it gets to that space, just like this time, I called my doctor. She said, go to the emergency room right now. And I did. I feel better. If anything happens, I will certainly be back. But I did not feel comfortable being in a hospital in the middle of COVID, and I certainly didn't want to be admitted. I didn't feel it was life or death, you know. Yeah. So I just felt like I'll be better off being at home. So even though I feel like, even though this is my new normal, and I am trying to get used to this new normal, I still believe, though, I just do, that I'm going to be good. I just feel like I'm going to get better. And, I am, well, I used to be this optimist, and since coming on YouTube, it's been such a blessing because even though as crazy as all of this may sound, I'm happy to actually articulate it, um, so that even if you guys say, hey, you're crazy, maybe that's the kick I need to do something better. But for right now, in the middle of this pandemic, I just want to, I don't want to go, I don't, I just don't want to be in the hospital trying to do, any kind of, you know, stuff, surgeries or anything like that. I don't, right now, actually, I don't feel as though it's safe for me to do that. Now, if it's an emergency where I can't breathe, I can't talk, I can't move, you know, I know how that feels, and I know what that means. Yes, of course, I will go to the hospital, but for now, I try to, manage, and I am fasting to help myself because I do believe in the power of fasting, to heal, to do a lot of healing. So I do believe in that. I'm not doing a water fast. I used to do water fast, but I'm not doing that because then I'm not able to take my medication, and I need to take my meds. So, especially when stuff is going on. So I'm doing the juice fast for now. So that's where I am. We have just passed the 30-minute mark. This is a very long video. Don't feel bad because, I've not, said everything. Some things, I feel like, not that I don't acknowledge it, but I just feel like I don't want it to be in this space. I don't want to give it any kind of legs. Like, you're not going anywhere. You're not going anywhere. We're gonna get rid of you. So, anywho, those are the things that are going on. I am very grateful that I have made it this far. 2017 was such a bleak December. December 2017 was bleak. It was bleak. By the time the doctors finished telling, my sister was there with me because she actually came to visit with my mom, and she was in the doctor's office with me, and it was like we both came out and we were just like, oh. It was bleak. 2017 December was so effing bleak. It was so bleak. But I'm so grateful that I am still here, and I am December 2021 starts tomorrow. Woo! So, yes, I'm very, very excited about that. I'm so excited. I'm so excited. Just get it. I'm alive December. Ooh, ooh. Okay. I don't know the words of that song, but anyway. Yes, so that's where it is. And so the juice feasting, we remember we're gonna do 40 days. This has been a hard November has been pretty tough for my family. Had a lot of emotional, it was like being on an emotional roller coaster, and not a good emotional roller coaster. But so I think because of that, I was finding comfort in food. And also though, my daughter who makes my juices for me, because I'm not able to make them myself yet. I can't stand up for more than 5 minutes at a time. So anyhow, my daughter, who usually makes the juices, she just has not been in that mindset to do that. So, and I also have been feeling that emotional pull, and I didn't like try to talk her out of it, but She says she's gonna juice today, and so we will be ready to go have a go at it. I've just been kind of just sipping water today. I had an orange juice, a big old 32-ounce orange juice earlier. So, but yeah, later on today she says she's gonna juice. So I will start then. But I definitely want to give a shout out to the lady called Shelly. Hang in there, Shelly. I am so proud of you. You have really inspired me. I showed my daughter your note, and I was like, look, this lady is doing this juice fast. We have to join her. So she's okay. I'm going to go ahead and juice. So we are back on it. And thank you for your inspiration. Keep on going. We're almost there till the end of the year. And so we have, I guess, 31 more days, right? Till New Year's Day. So come on, you guys. Anybody who wants to join us, Shelly has already started. She is already doing fantastic. Anybody who wants to join us on this next 31 days of Juice Fast, come on with us. Let's do this. We got this. Okay, and I will say, spend time, take time each day, this month of December. Take time each day to do some meditation. Take time, for those of you who believe in a higher power, take time to spend time to pray, to meditate, to be thankful. This is such a good time. It's a good time for us to be here. So many people did not make it this December coming up. So, we pray that we are all here tomorrow. And thank you guys for your inspiration. Thank you for pushing me. Thank you for all the wonderful comments. Thank you for checking up on me. Yeah, I still keep chugging along because I am determined to fast my way to health. And I don't know what that health will look like, but I am determined to fast my way to health. So with that, tomorrow I will be talking about, so this was a story time, and I'm sorry, this thing is so long today. So today was my meds and my diagnosis. Tomorrow we are going to now go on my history, because I kind of want to give you guys a background of myself, and in hopes that you all will also go back, those of you who are fighting with some health stuff, that you also will be inspired to kind of go back in your memories and try to figure out what happened, and how you got to where you are. So let's see. I don't know what this will. I don't know what this will do, but I'm just gonna go with it. I don't know what impact it'll have on other people and even myself when I do this, but I'm looking forward to it. It was just something that I thought of doing, and these days when I am moved to do something, I just do it. I just do it. If I'm moved to do it, I have this idea, I have no idea what's on the other side. I don't know why this came up in my head to say, hey, do story time. But it just popped up in there. And so gonna continue with that. It's the same thing when I started this YouTube channel. It's like it popped up in my head. Let me start a YouTube channel. And then later on, I realized why I wanted to start a YouTube channel about my weight, because I wanted to be motivated, to be accountable to you. If not myself, let me be accountable to you. So, and with the hopes that as time went on, I will then now be accountable to myself, you know? So, let's see how it goes. So, tomorrow it'll be a story time about my childhood in terms of around food. My childhood around food and how my family, used food or had food and stuff like that. And also any emotional aspects. Because a lot of times when you're obese, or you're unhealthy, or you're an addict for something else, it's tied into memories, And I know for myself, I ran from so many memories. So let's see where it goes. All right, 31 days. Join us. Thank you so much. Bye.